Hi, my name is Yae Kye, and I'm a second-year medical student at Paul Foster School of Medicine.
Hi, I'm Cicilyn Xie. I'm also a second-year medical student at Paul Foster School of Medicine, and our faculty advisor is Dr. Manglik. So today we'll be presenting on symptoms and preventative measures for COVID-19 in adults and children. These are the objectives that we'll be covering today. So by the end of this session, you should be able to describe symptoms of COVID-19 in children and adults and describe preventative measures for COVID-19.
So our first question is, do children get COVID-19? And the answer is yes. As of October 8th of 2020, there have been a total of 697,633 children cases of COVID-19. This makes up approximately 10% of the total cases in the US. 11 states have over 20,000 cumulative child COVID-19 cases, and those 11 states are highlighted in the navy square boxes in the right. So what does it look like for El Paso? As of October 16th of 2020, there have been 4,410 children COVID-19 cases in El Paso. If you look at this chart below, this is showing you the number of COVID-19 cases by age groups. You can see that the age group with the highest number of cases are in their 20s and 30s, showing 7,100 cases and 5,647 cases respectively. So far, COVID-19 seems to affect both males and females equally. Moving on, in El Paso, there have been 3,487 hospital admissions due to COVID-19 as of October 12th of this year. If you look at this pie chart, the number of individuals that have been admitted into hospitals are mainly of the older population. However, there have been some cases of teenagers and children that are 12 years old and younger that have been admitted into the hospitals as well. It looks like there have been 43 cases of children that were admitted into hospitals due to COVID-19 as of October 12th of this year. The graph on your right is showing you the number of COVID-19 related deaths by age and gender in El Paso as of October 12th. The age groups with the highest number of deaths due to COVID-19 are of the older population. There has been one death in the teenage population due to COVID-19 here in El Paso. So what does the timeline of COVID-19 look like? Once you have been exposed to the virus, to the coronavirus, you enter into the incubation period, which can last up to 14 days. Reports have shown that an individual, is contagious usually 2 to 3 days before they start to experience symptoms. More recently, the CDC discussed the potential airborne transmission of SARS-CoV-2. This is why wearing masks outside and when in public is important, as it will help reduce the risk of exposure. After the incubation period, you enter into an initial presentation, which is defined as when an individual starts to experience symptoms. Most individuals start to experience symptoms 5 days after they have been exposed to the coronavirus. Then you enter in the course and complications of the disease, where individuals present with symptoms that can range from mild to severe. We will be discussing the common symptoms adults and children experience in the upcoming slides. Then you enter the recovery stage. The rate of recovery depends on one's age and pre-existing health conditions. Reports have shown that for mild infections, individuals tend to recover 2 weeks after symptoms present. For severe infections, individuals recover 3 to 6 weeks after symptoms present. Reports have shown that children tend to recover a little bit quicker, specifically within the first 2 weeks after symptoms present. All right, so before we discuss the COVID-19 symptoms that adults experience, I want to bring your attention to this table on the right. This table is showing the CDC's current best estimate from reports and data collected regarding certain parameters. The CDC estimates that 40% of coronavirus infections are asymptomatic. So 4 out of 10 people will not exhibit symptoms, but will be positive for the coronavirus. Asymptomatic individuals are 75% more infectious compared to symptomatic individuals. And last but not least, the CDC estimates that 50% of coronavirus transmissions occur prior to having or experiencing symptoms. So now with this in mind, what are some symptoms that adults should expect and look out for? The most commonly reported symptoms are cough, fever and chills, and shortness of breath. Other symptoms include fatigue, congestion or runny nose, nausea and vomiting, diarrhea, sore throat, new loss of taste and smell, muscle or body aches. This is not a comprehensive list of symptoms. For a more extensive list, please visit the CDC website.
So according to the CDC, children with COVID-19 experience similar symptoms as adults, but the symptoms are usually milder. I've included a list of common symptoms that you may see in children off to the side, the most common being fever and cough. Something to note is that studies have shown that younger kids are more likely to have gastrointestinal issues like diarrhea and vomiting compared to adults. And these symptoms may even present before the respiratory symptoms like cough and shortness of breath. But in general, children seem to have milder symptoms. Children may also not have any symptoms even if they are COVID-19 positive, but these kids are still contagious and can infect others with the virus. More than 90% of COVID-19 positive children experience asymptomatic or mild to moderate disease. The children that are more at risk for severe illness include children with underlying medical conditions such as chronic lung disease, heart disease, or conditions that weaken the immune system. Also, infants under the age of 1 are more at risk. So, though children generally have milder symptoms, there have been a few cases of children developing a rare but serious condition called multisystem inflammatory syndrome. This is a condition where several organs in the body become inflamed. It's important to note that this condition has a delayed onset of about 2 to 4 weeks after a coronavirus infection. So it is possible for this condition to develop even after the child has recovered from COVID-19. This also includes the children that were asymptomatic. Some symptoms of this condition include fever lasting more than a day, abdominal pain, nausea, vomiting, diarrhea, rash, and bloodshot eyes. As of October 1st, there have been 1,027 reported cases of MISC in the US and 20 reported deaths in the US. As of October 13th, Texas has had 33 cases. So parents may be wondering if they should still take their child to well child visits. The answer is yes. The CDC and the American Academy of Pediatrics recommend that every child continue to receive routine vaccinations during the COVID-19 pandemic. Well child visits and vaccinations are considered essential services. These vaccinations protect children against 16 serious diseases such as measles, whooping cough, chickenpox, and the flu. A full list can be found on the CDC website as well as vaccination schedules. It's also good to remember that protecting against these diseases will prevent unnecessary visits to your doctor or the hospital, especially during this time. However, if your child has or may have COVID-19, they should wait until they have recovered before going to their doctor's office to avoid exposing others to the virus. So I'd like to point out that the common signs and symptoms of COVID-19 can also occur with the flu. So it's difficult to distinguish one from the other based on symptoms alone. And it is also possible to get both the flu and COVID-19 at the same time. So to reduce the prevalence of flu and reduce symptoms that may be confused with COVID-19, the CDC urges all individuals 6 months and older to receive the influenza vaccine for this 2020-2021 season. Preventing and reducing the severity of the flu through influenza vaccination could also help alleviate stress on the US healthcare system during this COVID-19 pandemic. So how to protect kids and teens. It's important to teach and reinforce good hygiene habits, especially when it comes to washing their hands when wearing a mask. For hand washing, you can try picking a song that can teach them how to wash their hands while making it fun. Our personal favorite is the Baby Shark hand washing song, and here we can play a quick preview of that song.
Wash your hands. Wash your hands. Wash your hands. Grab some soap. Grab some soap. Grab some soap. Grab some soap.
For masks, children over the age of 2 should wear their mask when outside and in public spaces. Try to emphasize the importance of wearing their mask, especially when they start going back to school. To make mask wearing more fun, you could let your child decorate their mask or pick out a fabric pattern if you're making masks from home. Also, it's important to remind children not to touch their face, especially if they haven't washed their hands, since the virus can spread if you touch an object with the virus on it and then touch your face. Here are a few tips on maintaining wellness in children during this time. Try to keep your child active. This can include going outside for walks, bike riding, or just getting up to stretch every now and then and have dance breaks. This will really help them burn off some energy after being cooped up all day. Something to remember, though, is that if you're outside, make sure to maintain social distance from other people. This pandemic may be really hard on kids, especially since they won't be able to do a lot of the activities that they're usually able to do, like hanging out with their friends. You can help your child stay connected with friends and relatives by setting aside some time to let them video chat with them. Nowadays, you can even play board games online, so that's always a fun option. Additionally, it's important to recognize when your child is sick. Like I said before, kids present symptoms slightly differently than adults, so it's important to be aware of that.
As Cece mentioned, this pandemic time can be very stressful. These changes in their life can place a lot of stress on kids, and it may be reflected in their behaviors. Some CDC tips for stress management is to be first aware of and watch for any changes in a child's or even your own behaviors. And those can include unhealthy eating, sleeping habits, changes in attention, and excessive worry or sadness. To help maintain and manage their stress, it's recommended to hold frequent discussions with your children and kids and to have these discussions in a safe space so that they can openly talk about their physical, mental, emotional state and stresses. We also recommend staying current with the latest facts of COVID-19. Some ways that you can stay up to date is by visiting the CDC website or the epstrong.org website, which will provide daily updates of COVID-19 in El Paso specifically. So what are some recommended COVID-19 responses schools should take? As in-person learning becomes an option for families, there are many factors that need to be considered and many questions that have been raised in terms of safety and the possible spread of COVID-19 on campus. The CDC has provided some recommendations on responses schools should take to help reduce the spread of the coronavirus and ultimately create a safer environment for in-person learning. Some key areas include 1, promoting behaviors that reduce spread, such as social distancing and facial coverings. 2 is maintaining healthy environments, disinfecting areas that are highly accessed by students, teachers, and staff. And 3, maintaining healthy operations, such as staggered schedules and working in smaller student groups. And 4, have a plan for when a student is sick. Parents and caregivers are recommended to work with schools and districts to better understand steps and strategies that will be implemented to help reduce the risk for students. There was a recommendation from an infectious disease specialist, Dr. Armando Meza from Texas Tech at El Paso, regarding in-person learning. He recommended that caregivers prepare necessary supplies, such as hand sanitizers and face coverings, into the student's backpack. It was also recommended that caregivers teach children and students the importance of why such supplies are necessary so that they are more aware of how and when these materials should be used. Some other recommendations were when you pick up your child or student from school, have them sanitize their hands before they step inside the car. In addition, have the windows rolled down on the ride home to facilitate airflow. And last but not least, it's recommended that children change out of their clothes and take off their masks as soon as they arrive home.
So parents and teachers may be wondering what the risk of COVID-19 spread in schools is. Well, the CDC has divided the level of risk by model of learning. Conducting all learning activities online has the lowest risk of spread since there's no in-person contact. Adopting a hybrid learning model with some virtual learning and some in-person learning, which includes small in-person classes, activities, and events, holds some risk. A hybrid learning model where it's mostly in-person learning and some virtual learning has a medium risk of COVID-19 spread. Other activities that have a medium risk are holding larger in-person classes and having groups of students and teachers overlap throughout the day. And students and teachers engaging in in-person learning only is considered the highest risk.
So no matter what you choose for your kid or student, whether it be in-person or distance learning, the CDC has a back-to-school planning checklist for both options. If you look here, this is a checklist for in-person learning, and it's a really nice tool for families to run through together and check things off with their student. These checklists can help families plan and prepare for their students' academic year. So that concludes our presentation for today. If you have any questions or would like access to the links and resources we use throughout this presentation, please visit the website listed on the screen. Thank you for listening in to our presentation on the symptoms and preventative measures for COVID-19 in adults and children today. Hope you all have a wonderful day.